Greetings, Dr. Helena Fontes, Director of Counseling Services at Central Division Victim Services. This is September, and as always, we're here to educate our community. This is Suicide Prevention Awareness Month. This is also Recovery Awareness Month. These two particular topics are important to our community. They're important because, number one, when a person is victimized due to a violent crime, they often want to escape. How do they escape? They escape through the use of substance. Sometimes they escape, because they want to rid themselves of the intrusive thoughts that are associated with the victimization. And other times they are prescribed pain relievers through their physician because of the injury sustained during their victimization. So they may be prescribed opioids, which we know is a highly addictive drug. A person may become addicted to this drug and may have a very difficult time trying to wean themselves off of this drug. Here at Central Division Victim Services, our counselors are trained to work with recovering addicts. We're here to help people to learn and devise a plan for a more healthier coping skill. And we do that through a theoretical orientation known as motivational interviewing. Similar to the model of patient-centered care, which is used in the medical field in the hospital setting, we help the client to develop a strategy to help them to learn how to wean themselves off. We're partnering with them. We are allies with them through this whole process so that they know that they're not alone. Nevertheless, we utilize these particular skill sets in order to help them to understand and recognize the addiction, the addictive behavior, and how it is hindering them from thriving in life. This is National Recovery Awareness Month. So we want to help victims of crime to understand and learn healthy coping skills. And we can help them to recover from an injury sustained during their victimization by giving them factual information, practices that have been researched and proven to be effective. But then let's talk about Suicidal Awareness Month. Again, September is also Suicide Prevention Awareness Month. Suicide is very important, and it's one of those types of ideations that interject in a person's life when they feel hopeless. I mean, they are in despair. We see this often because many of our people have lost loved ones due to violent crimes. And when a person loses their loved one, they feel like they have nothing left to live for. And so here we are to extend to them an arm, a shoulder, and some information that is very pertinent for them to not only live, but to thrive. To go through their grief process and know that they are not alone. We've recently started a group for mothers who have lost their boyfriends, fiancés, and husbands to murder. And we help them because they are raising their children now without the father being in their children's lives. So could you imagine the grief that these moms, these women must be experiencing? It's traumatic. And so we're here to assist them, but we do know that there is a time during the grief process where they're experiencing anger, they're experiencing depression, they're trying to negotiate in their minds how this could have possibly happened. They experience guilt sometimes because they feel like there is something that they should have been able to do or could have been able to do. And when they try to grapple with all of that negative messaging, they become suicidal. During our assessment, one of the questions that we ask is, are you suicidal? Are you homicidal? And if we hear them say that they are suicidal, we are going to help them to draw up a plan, a promise, a commitment, a contract that states that they will not kill themselves. And these are the measures that we will take to ensure that they, are committed to keeping their word in this contract as it has been written. And they have given a lot of input in the writing, in the development of that contract. But in addition, we make sure that all of our clients know that there is a number that you can call, where there is a crisis specialist on the other end of that call that's going to receive you and is going to walk you through the process of recovery from those thoughts. Because we know that, the thought does not have to become the reality. And we can help you to process that. And so the suicide prevention hotline number is 1-800-273-8255. No matter where you are, whether you're in Philadelphia, in Jersey, in Delaware, in Chicago, in Timbuktu, the number for the suicide prevention hotline is 1-800-273-8255. We here at Central Division Victim Services are honored to serve our community. We are honored and we are privileged to be able to walk with you as you recover. September is Recovery Awareness Month. What are you recovering from? Drugs, grief, victimization. We're here, we're trained professionals, and we're willing to walk with you side by side, arm in arm, because you are not alone. And it's our goal to help you to be ye transformed by the renewing of your mind and the healing of your soul. NewView Institute is a proud partner that works very hard to provide counseling services for our sister organization, Central Division Victim Services. If you need help, please don't hesitate. The suicide hotline is available for you. Their number again, 1-800-273-8255. Remember, you're not alone. No matter what those intrusive voices try to tell you, we in your community are here to support and to serve. Take care.